It's literally having a doctor in your pocket, but it's not just having a doctor in your pocket. It's community, it's education.
So what is going on with our healthcare system? It's hard for patients to get comfortable and to feel good when our doctors don't even feel good. Well, my guest today asked that same exact question. She started off as an athletic trainer, which is why she and I hit it off so much, and then worked to become an emergency room doc. ER docs have to be Johnny on the spot, in the moment, just like athletic trainers do. And so that is her nature. They also have to be people that find solutions to problems. Dr. Maureen Gibbons is exactly that. And she's reimagining the healthcare system to make not just patients healthy, to make doctors healthy as well. Today, we're going to talk about that. You're going to love this conversation. If you want to be at your best, you can't be physically ill. You have to be well. And Dr. Mo is working to make that happen. Coming up right now. Great day, everyone. I'm Mike Pawlawski, former world champion quarterback, serial entrepreneur, and award-winning TV producer and host. I've lived a life dedicated to mastery through performance and mindset integration. Each week, I'll bring you the insights, strategies, and stories from some of the world's top performers to help you unlock your greatness. Whether you're an athlete aiming for the top or an executive driving your team to victory, this is where you learn how to train your greatness to become an everyday great. Now let's get after it. So joining me now, Dr. Mo, and I just told you all about her, but tell me, Maureen, what is it, if people were to put this into a nutshell, what is it that you do?
The best way for me to explain it is I transform how healthcare providers and patients connect and thrive.
Yeah, and now Dr. Mo and I have had an opportunity to sit down and talk all about this. I think it's fantastic in terms of, you know, the solution that she's figured out. And you guys, the solution is so efficient and so sweet and so useful for so many people that I wanted you to hear about it. Dr. Mo, tell me about what it is that you've got going.
So I founded a remote lifestyle medicine practice, which that part's not unique, especially during COVID with telemedicine really picking up. My practice is largely asynchronous. So it's literally having a doctor in your pocket, but it's not just having a doctor in your pocket. It's community, it's education. My background is in sports medicine, wellness, professional, personal wellness. And this brings everything together into one package where patients can easily go back and forth. We have Wednesday night happy hour with the patients we all hop on a joint Zoom call. That's a new name we've started to call it, is happy hour, because it's more fun. It's all the fun without the hangover. And so we do that with patients. We do public lives a couple times a week, just not medical advice, but answering questions, because everyone has questions, but nobody can sit 3 hours in a waiting room, right? It's a little question. Then I also teach providers how to connect with patients on a meaningful base, in a meaningful way, through asynchronous telehealth and group care and things that feed their own soul at the same time.
Which we will get into all that and we'll pull it apart. But tell me why? Why did you do this? What drove you to set this up?
Well, from the back to the front, patients have always asked me over the years in the ER. I worked almost 15 years overnight in a level 2 trauma center, emergency medicine trained. And like I said, my background is sports med, wellness. It's just always been my thing. I'm also a certified sports nutritionist and a life coach. So all those things together. And patients have always asked me in the ER, oh, can I see you? Can you be my doctor? I'm like, I'm your doctor today, but that's it. And then, so what I started to do was be of value to patients, the public really. And people started asking me, can you be my doctor? I'm like, I don't know, maybe. And then my grandmother died. And I looked down the barrel of my life and I thought, is this what I'm going to be doing for 20 years? And I saw myself in my 80s in trauma bay 3, dying of a heart attack, working at trauma because they had to drag me out of there kicking and screaming because I absolutely loved my job. But parts of my job did not love me back. Working overnight, we all know. I mean, nights, seeing what a trauma doctor sees in the ER, right? It's not just trauma. You know, an emergency medicine physician sees heart attacks and trauma and child abuse and amazing saves and amazing people. But again, even the amazing ones, they take a piece. Everybody takes a piece, and you come home with a lot less than you left with a lot of times. And physically, we know nights is detrimental. Although I love them, I still do work overnight in the ER, very little, but I only work overnight. I'm a nocturnist. It's what I do. But I can't keep doing that. And it wasn't out of desperation. That's the difference. This came out of pure love, pure service. People asking me, well, can you help me? Yeah, I can. So I kept finding ways. Every day was finding another way. How can I help you better? How can I help you better? And it just grew. And then I needed more people. And then I needed more people. So I have trained other providers how to do this to help me. And now I train other providers how to create their own practices because, rising tide lifts all boats. If every patient showed up to my door and every colleague I know that needed us, we wouldn't be able to handle the volume. So I have no problem training other providers to come up and help. The world needs good doctors. The world needs good nurse practitioners, PAs. We need connection. We need patient provider connection. So it really organically grew, and I feel like it not only saved the lives of quite a few patients. I claim to fame there. We've got, I think, over 10 patients now that are well over 100 pounds down. Wow. My dad and I together are over 100 pounds down. So it's just
that is. Go ahead.
So it's just been extremely rewarding in ways that I didn't see coming.
What I love and what I hear is it was when you do this for the people you're working for, right? Trauma, being an emergency room doctor, I just imagine, my backstory, but for people at home who don't know my backstory, I was born with cystic fibrosis. And so as a little kid, I was literally in the emergency room every single year with lung disease. I was in there several times. The doctors told my parents, if he makes it through the night, he'll probably make it. And it was one of those doctors that told my parents to put me into sports, which is what started my career, down every sport going to strengthen my lungs, to make me stronger, to give me confidence, to do all those wonderful things. And so knowing those doctors who truly care, and what I hear when I hear you talk about this is that you care. And so talk about, as a doctor, that kind of connection you get with the patients and that the kind of responsibility, because you said it takes a piece. What kind of responsibility do you feel and what kind of connection do you make with your patients?
That's interesting because in an emergency medicine setting, I have a knack for creating close connections with patients in a hurry. And I cry with my patients. No one dies alone on my watch. It's easy, not easy. No, I guess I just open myself up to it. I'm willing to cry with a patient. I'm willing to sit with a patient. Forming those relationships is hard. But it was always, it's just the way I do things. I don't even know. I can't really explain it because it's just, it's like when you apply to medical school and everybody says, I want to help people. Like everybody has the same statement. They say, you need to make yourself look different. Well, I don't know how. I'm just me. I'm going to show up. I'm going to be me. I'm going to help people. But my forte, actually, I don't believe was ever the medicine, the truth. I could do the job, but that wasn't where my strength was. I could poke some holes in some people. But, or, open up some holes or whatever. But my strength was connecting with the patients, making sure after a trauma and we had a bad outcome, I talked to the nurses, I talked to the staff, I made sure they were okay. My forte, it just always felt different. Like I was called to something a little different than just treating the patient's illness, if that makes sense.
That totally makes sense. Like I said, as a person who's been in hospitals a lot, person who's been around doctors a lot, now 29 procedures or surgeries, it can be intimidating. And so having a doctor who you can relate to, having a doctor who is connected with you makes a huge difference. How do you find that affects the patient? Because that's really your job there, right? Med school, when you break it all down, is vocational training. You're learning how to do the job. And so your job there is to help the patient in their entirety. Yes, you're supposed to cure what ails them if you can, but it's to help them in their entirety. And I think that gets lost in these hospitals sometimes for the bureaucracy.
That's very well said. It 100% gets lost. And interestingly, I've seen it get lost in my own company over the past 1.5 to 2 years, give or take. Because once you hit a certain size or once you hit a certain number of people, and my company is very small, we're less than 20 people, but in a huge hospital system, they're working on metrics. They're working on pushing patients through. There's always 30 in the waiting room. There's 20 backed up in the ER that have to be transferred upstairs. And even in my company, we've got to find ways to make the processes efficient that can be automated and or systematized while not removing the part that shouldn't be, the patient connection. And that doesn't have to take a long time. I can form a relationship. I can name that patient in 3 notes. No, I can form a relationship in 2 minutes with a patient, just because it's just, oh, wait, they're like, oh, we just moved down here from Michigan. Oh, where in Michigan? I went to grad school at Kalamazoo. Just everyone knows someone from somewhere. And it's just showing people that you're human, you're present, you're showing up, you're listening, you care about more than the fact that they have chest pain. Or, granted, in a critical situation, I'm sorry, I don't care where you're from, I'm just going to save your life, the rest is gravy. But in every other situation, which is 99% of them, it's that connection that I hope makes patients feel that for a split second, while I'm dealing with you, you are my patient. You are my responsibility. And it's your responsibility to connect with me. Don't hide stuff. I think it fosters that because even in the remote practice, I've got to rely on the fact that people are telling me the truth.
Well, that's always a difficult one, no matter what you're doing, from the law to medicine to coaching. I mean, it's all about people aren't always aware of what they're feeling or what they're sensing or what they're thinking either, right? There's always biology as opposed to psychology and all that stuff mixing together, and especially when they're in a fear state coming into an emergency room, that's a big one. So anybody listening at home understands why I love Dr. Mo. It's like the dry sense of humor where she can poke holes in people. And I mean, there's stuff that comes out that just kind of hits you out of the blue. I absolutely love that about you. And I can see why your patients and why, your providers and the people that you work with would have that relationship with you. Just that ability to connect, right? The humor goes a long way in terms of connection. How much do you find that the humor works with your patients? How much do you find that helps?
I think it helps. I think it helps a lot, especially in our Wednesday night happy hour. People get a kick out of it. I mean, and I don't do it to be funny. This is me. This is who I am, and I think that's it. I give patients who I am. I'm not, as you see, I'm not in a white coat. I did my half Ironman last weekend in Galveston, so I'm sporting the shirt, right. Proud of the shirt.
The big half Ironman survivor here. I love it.
That's right. Right. And I think that was my 9th or 10th. I don't remember.
Wow.
But this one, every one of them, I'm proud of them for a different reason, but this is a big one. I was proud of that one. But again, I'm not showing up in a white coat. I'm not stuffy in a white coat. I'm not standing here looking down on my patients. I'm sitting here on a figurative bar stool with my patient at happy hour. And we're chilling and they're asking questions and, they're going to hear things from me and they're going to see when I get angry when there's like, my last provider did this or whatever. And I'm going to get a little feisty now, but I also understand from those providers, like we talked about in a corporate medicine environment, providers are locked in. You don't have creativity. You don't have a lot of autonomy and you don't have any time.
And what does that mean for the patient?
Things get missed. Patients feel, even myself as a patient, when I make an appointment, first of all, I dread making in-person appointments. I dread it. But you got to go in. There's no pap smear happening from home. So, you go in and you sit in the waiting room and then you sit in the room. And then, and depending on your doctor, you might wait in the waiting room for 3 hours for an office appointment that was scheduled. and they give 5 minutes, and then they're like, you only had 5 minutes. Well, they don't have any more time because they've got a document, or they've got this, or they've got prior authorizations to do because they don't have the money to hire staff or whatever. It ruins the patient experience. Makes us not want to go.
How much of that is the bureaucracy of the legal side and the insurance side, right? So because it's really this battle between billing and legal and patient care and doctor availability / time plus process, that's mixed in with profit and then outcomes. Like, in the midst of all that, where does a patient fit in?
At the bottom. But the problem is that although, we want to blame insurance, or we want to blame the legal system because, costs go up because liability goes up, and then insurance has to pay for that. And then cost of insurance goes up, and cost of services goes up, and then medical school tuition goes up. And again, there are so many costs incurred with training a physician, or even from a medication standpoint, with research and development in this country because of the regulations, because no one wants to take a risk. Well, there's a risk with everything. There's a risk-benefit ratio to the thoughts you think, to the food you eat, to the activities you do. And everything in life is a risk, but do you want the benefit is the question. Now, we try to take all that. We don't even mitigate it. We try to take all that risk, which increases cost. We need 18 different double-blind studies to FDA approve a medication. Well, that's going to raise that cost of the medication 25 times. It is what it is. And we don't think about that. And all of these multifactorial things, I kind of liken it to building a hospital, right? A hospital gets built in the 1800s, and it's a nice small hospital. And this little doctor has his ward, and he takes care of his patients. But then he realizes there's 100 more patients that need me that I can't take care of. How do I take care of these people? So he builds on. And then when he builds on, he has to hire more people and train more people. And then those people need insurance and unemployment and whatever, and everything else that's required by law. And so then the hospital builds on another wing, and then another wing, and then another wing. And so you pull into the hospital and you're like, I don't even know where I'm going. This place is huge. There's 18 different rooms, and none of the rooms are communicating with each other. None of them look the same. Nothing has the same architecture. That's what our medical system has become, where we just keep trying to put Band-Aids on the hole from the Titanic and the ice and the side of the ship. And we're just moving deck chairs.
And that's where your solution comes in.
Yep.
This is the beauty of what you have done. And you keep talking, you allude to the happy hours and, the ability to connect with patients. Talk about your solution. Tell me about what you've done and how that affects people.
So the interesting thing, I cannot replace in-person care, period. No chance can telemedicine replace having a primary care doctor that can put a stethoscope on, emergency medicine doctor who can stop the bleeding or get an airway. That is invaluable. However, for so many concerns, you could come and talk to one of us, because we do lifestyle medicine. So we do a lot of weight loss, hair loss, longevity, sexual vitality. A lot of that we can gain by history, right? And we get vital signs from your last doctor's appointment, or I can't replace in-person care. But I can hop on with you. You can shoot me a text and say, hey, this is what I'm feeling today. What do you think about this? Usually within 12 hours, definitely within 24 hours, you will have a reply from one of my nurse practitioners and or physicians that says, here's what we think. Or I think I got a urinary tract infection. I get them. Is it this, or this? Because then it needs to go to the ER. If not, then here's some antibiotics and we'll see what happens. Like appropriately treating and speaking to the patient, but it kind of almost circumvents the system a bit, where we can decompress the system so the airways can get managed, the bleeding can get stopped, both in one patient and metaphorically with the whole system.
Well, so it's a beautiful thing, because this is really what I tried to create for myself. Like, it didn't exist in the system out here, but I'm an ex-athlete, and being that I have contact with a lot of docs, and being that, these guys like the football insights and everything else that I give them, I have these guys on text where I can go, hey, doc, what do you think of this? Hey, doc, what do you think of that? Hey, can you take care of this? This is what I'm feeling. I've created kind of your system for myself. But I realized that I'm not the average patient. Like that's not what most people can do. Most people get to see their doctor, as you said, for like 5 minutes. They get in to wait for 45 minutes at an appointment, and they go home pissed off that they only got 5 minutes. And so because of what I've done and the people I've met and the network I've built, I've been able to do that for myself. And I just my mind just spins when I think about the possibilities for what you've created and the ease that creates for people.
Yeah, and a lot of people now are going to it's a DPC, direct patient care platform, which is similar, or a concierge medicine. This isn't really I don't do a concierge medicine practice, for the very fact that a concierge medicine is when you need them, they're there. I want to make sure patients are talking to us monthly. They need community, they need education, they need connection. I tell people I lure them in with medication and then coach them to death.
I love that, though. As an athlete, I love coaches. I love people who are always there. Yeah. We forget things. You hear things, you learn things, they're life-changing insights, and 15 minutes later, we lose it because we start thinking about something else.
Yeah, we need repetition.
Yep.
Yeah, we need it over and over again. And that's why, because people ask, I'm really sorry to ask this because I'm sure everybody here already knows. I'm like, no, you need to ask, because even those of us who do this for a living need the reminder.
I'm going to put you on the spot. You have, without giving names, obviously, HIPAA, do you have a great story about something like that?
So one of my favorite patients, she's one of my originals. I think she was my first. She might have been my first patient, actually. And she's actually signed a consent. So, well, she signed a consent for social media. So her first name is Jackie. And Jackie is amazing. Or we can use Sarah. I've got two patients, two of my favorites. They have both lost well over 100 pounds. Sarah was just on the news, actually. And she's lost 125 pounds. She's she doesn't even look like the same person, right? Like when I talk to her, it's just like, it's almost like I'm talking to a different human being when I talk to her. Jackie's before and after picture are so funny, because the first one, she's drinking a Bud Light. She's just not. And the second one, she's in a gym posing a gym selfie, right? Like it's just that's the perfect, Jackie's like my perfect patient. We've got tens, 20s of those, but she went from just enjoying herself, was going out indulging. And I'm not saying she doesn't do that ever now, but it's not the life she lives anymore. She's given a new lease on life, right? Where she doesn't need that, and I've heard it said to me quite often, build a life you don't need to escape from. That's what I try to help.
Yeah, that's pretty profound.
Yeah. Yeah, because
go
ahead.
Go ahead.
Well, because it's what I do for providers as well, right? Because it's not just, I joke, lifestyle medicine isn't just for the patients. Because what do doctors do when they go home? I need a glass of wine. I need to check out. I need to, I'm going to go lay down on the couch. Whatever. Life needs you. Life needs you present. How can you use your medical training, stay in medicine in a way that you do something on the side or supplementary that not only supplements your income, but feeds your soul so you can come home with something?
And so, such a fantastic point, because just like they teach parents or spouses or coaches or anybody else, you can only give what you have left in the tank. You can't, you don't rise to the level of the occasion when you're burnt out. You don't bring your A game when you're feeling like a Z. Like, you don't have that, nobody has that inner reserve to be able to get there when they've worn themselves out. And I see it all the time. My wife, God bless her, is a CPA. Tax season and D-Day is unbelievable. And I watch her grind and grind and grind and grind. And then at the end, it's like she doesn't have a lot to give. I call it being on Susie support during tax season. Whenever, I'm cooking dinners, I'm cooking lunches, I'm cleaning as best I can. I'm not a great cleaner. That's just, I'll give you an insight. I don't clean well, but I clean what I can, but I take care of things, right? I'm running the errands, I'm doing all that because I see how hard she's working, and I try to be there to support her. But if you don't have that, if as a doctor you are constantly filling out forms and taking care of insurance and taking care of patients and doing business or office hours and taking care of the business side of things, and there's only so many things you can stack on top of a daily schedule. And I've got a quote in my book where I say, you can accomplish whatever you want to accomplish, but you can't do whatever you want to do if you want to accomplish. There is a certain list of things that you have to do for any prospect, for any outcome. And those things have to be met. And if they're asking you to do a million things that aren't in that list, then the outcome just can't be hit.
And it really can't. I mean, that's when you have stacked your to-do list. And as a business owner, I see that when there are tasks that are, that like you said about cleaning, right? There are things I'm good at and there are things I'm not good at. The goal for me is to put myself in the position where 80% of what I'm doing is what I'm good at, because that's what brings patients. That's what drives providers. That's what's going to inspire someone to change their life, right? If I'm down there at the bottom, sending out invoices, I can't accomplish the things I need to accomplish. And that's real life. As much as you want to do everything, because I want to do everything, you can't. You need people. Again, that's you.
I know you, by the way. I know you well enough to know that you want to do everything.
Yeah, I do. I want to do everything. And that's the tough part because, I want to rescue everybody. I want to save everybody. I want to make sure everything is done the way it needs to be done. But sometimes other people will do it better. And if I don't learn to connect with people, I won't get them on board to help me help other people. And that means I can't sit in that spot where I'm making a difference.
You have to have the depth in your reservoir to make that happen, which is amazing. You have to have that reserve. And you talked about changing their life. We talked about patients a ton, but there are probably doctors that are going to listen to this as well. How do you change that doctor's life? Yeah. How do you change that doctor's life? I have a bunch of friends who are doctors, so I know several of them will be listening, but how do you change a physician's life? How do you change a practitioner's life?
So the interesting thing, and what I found, I've always thought differently. Well, we're going to phrase this nicely. I've always thought differently. It's funny because when I was younger, my dad's like, you're going to have to think outside the box. I'm like, I don't even know there is a box, looking back. I don't even know there was a box. How do I think outside of something? It's like a fish. You got to think outside of water. What's water? When we're trained in traditional medicine, there is a certain way you do things, and that's it. And even so, we're refining an electronic medical records system to enhance the way patients and providers communicate. And my development team will ask me questions. And they'll say, well, why are you doing it this way? And I'm like, because that's the way we do it in medicine. So I think from a provider standpoint, the biggest thing in my transformational coaching side, what I need providers to see, doctors, nurse practitioners, PAs, anyone who gives out healthcare, I need them to see that things can be done in a way that you don't see. And there's a different way for you to not provide the same care, but to provide care in a way that is, it could even be in a way, or if it's coaching, right? You're the first one to speak to about this. If a doctor could change the lives of 100 people in an hour versus 3 patients in an hour with the documentation, we still keep him on the ground, right? Keep him on the ground half time in the clinic doing his thing. And then we have him out giving, weekend seminars to patients, to the public, where he's, it's obviously not a patient-provider relationship, but he still makes a difference, changes the lives of people. that feeds back into his soul. He passes that on to those 3 patients an hour, 4 patients an hour, 5 patients, 10 patients an hour, depending on what you're doing. But it's just, I open doors where people saw only walls.
Yeah, that's outstanding. Then you think about that pass-on effect too, right? As the doctor now is feeling better, fulfilled, having more purpose in what they are doing rather than just being, a piece of the machine. Now they pass that on to the patient. How many people does that patient then touch?
Right.
That it then changes their life too, right? Because we're passing this on. Hopefully this podcast touches somebody and they can change a life. And if it's a physician, now they're changing patients' life, which then change their family's lives, or which then changes their students' lives, whatever it may be, right? And so you can touch one person and affect an entire village. And if you can touch people like physicians who have contact and who have real, deep, meaningful effect in people's lives, deep, meaningful effect in people's lives. I know this firsthand, right? I've had my life saved. And I've had doctors who almost killed me because of the system. I couldn't get the surgeries because of the system, and literally had to threaten doing a documentary about what was going on with the insurance before they would let me get to the surgery. And so I've seen it on both sides. I've seen great physicians doing great work, and I've seen physicians getting their hand tied from doing great work. And I've seen physicians who didn't quite honestly care, which is that's a different podcast. Yeah. But we're not talking about those physicians. No, with you, we're talking about physicians that care, but who can affect people. And how far does this track down? That's the thing to me is how many people does it end up touching?
Well, an interesting tenet to that is people say, oh, you're taking people out of medicine because you're taking them off the ground and putting them into virtual care or virtual platforms. But I'm not. Instead of them wanting to leave medicine and go to real estate, because that's what people are doing, right? They're trying to get into real estate, trying to get into side gigs, trying to get in. There are Facebook groups galore on how to retire from medicine and do non-clinical work because we're all burned out.
Right.
But if you have something, say you do half-time, but you could do it for 20 more years, you're still affecting lives, right? So not only does it go downstream, it goes across chronologically where you can help people for longer because you've got that opportunity, because you can show up at work. If you're only working, say, for emergency medicine specific, you go from 12 shifts to when I started working 6. When I go to work, I would have so much more in that reservoir, right? Even though I was working like a dog outside of it, because this is exciting. This is very exciting. I get to change patients' lives. I get to change providers' lives. I get to do all kinds of fun stuff. But then I go to work and I'm like, oh, look, here's this or here's that, or, call the helicopter, whatever.
Well, and that gets back to basic psychology, right? That's self-determination theory. When you're in the machine where you're just constantly under pressure and you're getting burnt out, you feel like you have no control, you get into that stress response. You get into that place where you feel like there's no escape, right? You're going back to Martin Seligman's experiments. You're that dog who can't get off the electric plate. And so now, though, when you have an outside, you have control, you have an ability to change your trajectory as a physician or as a patient, for that matter. I think as a patient who you talk about going in to see a physician, you sit there for an hour, you get 10 minutes or 5 minutes or whatever it may be, and you feel like nothing's changed. So they prescribe you some pills, they send you home, and that's that. Or now you can get on the phone, or you can get on a text with your doctor. You can get on a Zoom chat, something where you can get your questions answered. You can get your fears allayed on whatever it is, right?
The fears.
What a difference that makes, because now you have control in your life. You have some say in what you're talking about.
And you can make an informed decision, right? Because people will ask me, well, what about doing this, or should I do this, or should I do this, or, treatment pathways. And we say, well, listen, and I do the risk benefit thing. So, here are the thoughts. We can go this way, we can go this way. This way is more expensive. This way isn't, this is how we can do it. here's the risks, here's the benefits, and then it's an informed decision, but we don't have time in the traditional medical system to sit down and explain all of that. And if you do, your numbers tank, so you're not doing a good job because you can't keep the department going. And it's very valid. Those patients need to be seen. That 50th patient isn't any less valuable than the first one, but I'm only human. And now as a provider, the flip side, now I have a provider's choice to step on that electric plate. I know it hurts. I got it. It's all right. I can handle it until I'm done. And then I do the other thing. And then let's fill up the cup. Let's fill up that pitcher, and then let's go back. And it is depleting. It is invigorating, right? It's like golf. That one good shot keeps you coming back. And that's why I was there for 15 years. I lasted much longer than the vast majority of full-time emergency physicians, especially at night. The average age of retirement now for female emergency physicians is in their mid-40s.
Wow.
I mean, that's where what are we doing? Especially since COVID, when they all had to homeschool their kids while working full-time.
Yeah, COVID changed everything, right? On top of the ridiculousness that already exists, because let's face it, it's America. Our diets suck. The way we take care of ourselves, not fantastic. We're so performance oriented that we don't think about the person inside the performance, right? It's all physical. It's there's not a lot of mental behind it, so we don't take care of a lot of that. But then COVID just changes the whole scenario entirely.
Yeah, that was interesting. It went from at the beginning of, am I going to bring this virus home and kill my family? I treated the first 2 patients in the Houston area that came off a boat from Egypt. And we didn't know. I was literally worried, am I going to come home? And I don't want to belabor the point because we all lived through it. Nobody needs to relive it. But
it's a point though. I mean, these things are traumatic, and physicians still have the trauma of having that burden placed on them.
That's a very good point, because almost toward the end of the COVID pandemic, Ebola came back out. And we had to go through training on Ebola donning and doffing. And I actually thought to myself, if Ebola comes out, I'm bagging it. I'm done. I can't. I love my job, but there is only so much I can give. I was done. And I got a fair amount of resilience. My husband's actually doing his PhD in health and human performance, and he's doing it on physician burnout and resilience. And it's fun household living.
Right, for sure.
Kid's like, what, Mom, what? But, he talks about how, you got the diet, the activity, and my diet needs a lot of work. If my patients are listening to this, they're like, yeah, she's a hot mess. My diet still needs a lot of work because the circuits are broken, right? They've been broken for 45 years and we're only 2 years into this. And again, it's the long game. And it's been, a year or two since the pandemic is over, right? That trauma takes a long time to rewire in your brain. It takes invested thoughts. It's any trauma you've been through, which we've all gone through our things, but it's actively rewiring. It's having, that's why we do community, we do education. It's not just, yes, we do medication. I am absolutely all for medication that will help you without a risk that will hurt you, right? But we need to do this together because that's how we grow. That's how we survive. That's how we thrive, whether it's providers or patients or all of us in this together, right? We're all rowing the same boat.
That's it. And so keeping our physicians healthy is as important as keeping our patients healthy, because in order to keep our patients, the Gen Pop, like me, healthy, our physicians have to be healthy, physically and mentally, which to me is what you're doing.
I'm trying.
Yeah. Well, I mean, nobody can take the whole system on for themselves, right? But your piece of it for the physicians that you're working with is a boon.
But remember how we said I want to do everything?
I know that about you.
People will say, you need to start lobbying. No. I'm just going to do it myself. I'm going to do it from the bottom.
Yeah, lobbying. Another thing to add to the plate, right?
Right? I'm like, no, and that's the thing. I don't think we're going to change it from the top. I think we're going to change it by training one more physician to interact skillfully with a patient over a platform that doesn't waste anybody's time, right? You don't have that hour. And if you tell me, oh, you can't, text isn't a good way to communicate. How are you communicating with your kids these days? It better be a good way to communicate. You better figure it out because that's the way we communicate.
For sure. Everything's changed, right? Now we type with our thumbs. Nobody knows how to type anymore. They were all typing with our thumbs on our phones all the time. It's completely changed human history. So where can people find out more about what you're doing? Physicians, patients, anybody who can benefit, which is anybody. Where can they find you?
So, in general, I wrote a book called Happy First, right? That's the foundation of things that's the first book. Second one's coming out next year. That's the foundation at happyfirstbook.com. That's like basic brass tacks, how to actually be happy. Start there. As a patient, my practice is at amstelehealth.com. And if you're a healthcare provider, I have a public group. It's at atcpublicgroup.com. That's paying homage to my old career. It's active telehealth consulting, but it's ATC, which is athletic trainer certified, which I held that certification for 26 years. I was an athletic trainer at Heartland, sidelines. That's what I did. 26 years at that. But, now it's just my atcpublicgroup.com.
I love that too. And you throw it out there and like as an athlete, that athletic trainer, that is your lifeline. That's the person who's doing exactly what you're talking about in terms of being there for the questions and you talk to and, hey, I'm feeling this. This is what my body's doing. Oh, I've got this, going on. Like I can name my trainers throughout my career, the guys that changed, my entire career, taking care of me. Bob Orr at Cal and Medusa at Cal taking care of me. And then going on to the pro game, I can go all the way through Greg Dashnaw, Albany, like all these guys who were my dudes, which is really what you're doing. You're really back into that with what you're doing with telehealth.
That's funny because that's my thing. That's my, I am a high level athletic trainer again. But it's what I do. I'm the one saying, hey, what do you need? How can we solve your problem? Right? Because athletic trainers, you're in a little room with nothing, and even at high levels, what do you have? You got a roll of tape and a brain. That's about it. Like, how do I solve this problem? How do I MacGyver this problem? And
little pre-wrap and some moleskin. Here we go.
Right? Let's figure it out.
Yep.
I know. That's exactly it. That's always been my personality. And my dad actually recently told me, he's like, no, you've been a serial entrepreneur forever. You're always solving a problem. I'm like, yeah.
Yeah, that's it. I think you solve a huge problem here. I really do. I appreciate you coming on with me here today. I mean, it's always fun to catch up. Hey, love our talks together. Like that, it's so easy to talk to you. Such, so many fun stories, so many fun things that we didn't even get to today here in this conversation. We're going to have you back. But you can see why I love Dr. Mo. You guys will love Dr. Mo as well. She's just awesome. And that athletic trainer mentality, I think, to finish on that's exactly it. If you have ever played sports and you've had an athletic trainer, you know how much they mean to you. You know how important they are to you as an athlete. We would not be able to hit the field without them. And I think that's Dr. Mo, and what she's doing is creating that environment, which is such a powerful environment for people, for patients especially, having some control, having some say in what you're having to do. So, Dr. Mo, awesome to have you on.
Thanks for having me. Yes, chats are always good. I'm always up for mic chats.
Yes. And so we will put all of the contact information in the show notes down below. Do not fret. You can mention them one more time here again. Where can they find you?
Practice is at amstelehealth.com. And all of the links for my socials for providers are actually at newmedcareer.com. That's easier.
There we go. And the book?
happyfirstbook.com.
Keynote.com. There it is. So it's all right there in the show notes down below as well. Dr. Mo, appreciate you coming on. For everybody listening at home, hopefully you kind of got a sense of everything that's going on there. Such a unique departure and such a game-changing thought process on helping both physicians and patients, which just trickles down to everybody else. But as always, I appreciate you guys coming on, and I hope that you have a great day today. Don't forget my book. You can go to Everyday Great and text GREAT to 55444. You can find out more about all of this, and I'll be talking to you again soon.